about a third of the cases of active TB that we see in the world are in women, and it predominantly is during reproductive age. And we know that women who are pregnant actually have twice as much of a risk of getting active TB than non-pregnant women. So it's a huge issue. It's a huge cause of death. And as it ties to pediatric TB, if you're a child and your mom dies from TB, your outcomes are very, very poor. I mean, the chances of you doing well are very bad. So it really, the two are very, very intertwined. They're very linked, and I think it's a huge burden of disease for both populations. Yeah, so what we've been looking at is looking at diagnosing latent tuberculosis during pregnancy with the hope of being able to prevent the reactivation of TB. So we think this is important, one, because there's reason to believe that the immune changes of pregnancy predispose a woman to reactivate tuberculosis, but also, two, because in countries like India, and I imagine sub-Saharan Africa is kind of like this too, pregnancy is often the only time that a woman interacts with the healthcare system. She'll may hopefully get antenatal care, sometimes will come for delivery, and then we don't see her again until the next time she's pregnant. So this is really the only time she comes to us and we can actually do something about it. So prevention is just such a huge issue for her and for that specific demographic. It's a great question, and it's actually something I'm hoping, similar to pediatric TB, will start to gain some more momentum, because I don't think that it's really at the forefront of people's minds, and understandably so. There are a lot of other issues in maternal health that are big issues: hemorrhage, postpartum sepsis. I mean, there's all sorts of other maternal health issues. However, in countries that have a high burden of TB, I think TB should rank pretty high among those also, and I don't think it's something that we've really taken seriously yet. So there's a few people I've actually met with at the conference this time that are looking at how do we screen for active TB at delivery? What are the best ways to do it, taking into account some of the immune changes, but also taking into account that this is, like I said, their only point of care, their only point of entering into the healthcare system. How can we optimize doing as much screening as possible when we know she's at least there for 24 hours, right? So what can we do? Can we use Gene Expert to help diagnose active TB, because at least we could get the results back before she goes home with her baby and we don't see her again, So I think that it deserves more attention. I think it's going in that direction, but I think we're not quite there yet. Yeah, I mean, again, there has been pretty good demographic data about active tuberculosis peaking between the ages of 15 and 45 in women, and we don't fully understand why that happens. We assume that it has something to do with hormonal changes and that type of thing, but we don't. It's actually not very well described, and that's kind of the type of work that I'm hoping to do. But I think an additional barrier that Dr. Hessling alluded to, and it's come up in a lot of women's health issues, is young women have more of a barrier to accessing healthcare. They're less likely to go to see a doctor. And women in general, I'm not specifically sure about adolescents, are less likely to have the traditional symptoms of TB. They don't have necessarily cough, fever, night sweats, weight loss. They might have nausea, they might have dizziness, they may have a dry cough but not a productive cough. So they're less likely to think that any of those symptoms are severe, and then they're less likely to seek healthcare because of them. I think the primary thing was that as a young woman myself, and as a person whose family is from a country that's a high TB endemic country, just the thought of young women having as many barriers, I mean, it really just reminds you how lucky we are in the U.S. to be able to go to see a doctor, to have reminders about when you're supposed to go for your screening and how much antenatal care you're supposed to have. And I mean, all of that is so taken care of and kind of taken for granted to a certain extent. And when you go to India and you see these just swarms of pregnant women, and they're completely disempowered, and they can't even necessarily consent to our study often without talking to their husband first, and they can't come back to the clinic if they don't feel well because there's not enough money for them, but there is for their husband. It just breaks your heart, because you just see yourself so much in them.